The Hilinski family has been open about their search for answers. According to them, the Mayo Clinic doctors were also curious and requested to do an autopsy of Tyler's brain. The family says the results indicated that their son had signs of chronic traumatic encephalopathy, known as CTE, a degenerative brain condition many scientists say is caused by head trauma. It has been found in athletes, military veterans, victims of domestic abuse, and others with a history of repetitive brain trauma. In CTE, a protein called tau forms clumps that slowly spread throughout the brain, killing brain cells. The disease has been seen in people as young as 17, but early symptoms usually appear in patients in their late 20s or 30s. It could be years after the onset of head impacts. Some common changes seen include memory loss, confusion, dementia, impulse control problems, aggression, depression, and paranoia. Symptoms get more severe with age, even if the patient suffers no additional head impacts. CTE was first introduced in 1928 when doctors described a group of boxers as having punch-drunk syndrome. A 2017 study published in the medical journal of JAMA found CTE in 99% of deceased NFL players' brains that were donated to scientific research. Studies sponsored by the Brain Health Institute for Athletes at the University of Texas at Dallas point to changes and noticeable abnormalities to the brain's white matter after suffering a concussion. You can think of the white matter as the subway of the brain. It's the cumulative mass of insulated nerve fibers that connect one neuron to another. Normally, signals are passed along these fibers at high speeds, but after a concussion, when the brain is rattled inside the skull, some of these connections can stretch or tear. This has helped researchers identify the potential link between concussions and depression. Neurologists say it's worth considering because the mood disorder can lead to suicide if they're not treated. This was the case with linebacker Junior Seau, who played in the NFL for 20 seasons and took his own life in 2012. His autopsy report revealed signs of CTE. Although the disease cannot be formally diagnosed until after death, specialists say symptoms of CTE that may be experienced during a lifetime, such as depression or anxiety, are manageable. This is why it's important for someone experiencing these symptoms to have an evaluation by a neurologist and work with them to figure out a treatment plan. Rose Belts, Crime 2 News.